to this episode of Sit, Sip, and Synapse. Today's episode will be featuring Dr. Hamilton Hall. He's a professor in the Department of Surgery at the University of Toronto and is an orthopedic staff at the Sunnybrook Health Science Centre in Toronto. Due to his massive interest in patient education and rehabilitation, he founded the Canadian Back Institute, which is now known as the CBI Health. He's the co-founder and executive director of the Canadian Spine Society. He served on the editorial boards of The Spine Journal, and The Back Letter. He's also the author of the best-selling Back Doctor series of books for the lay public. All right, so here we have Dr. Hall. I'm going to talk a little bit about chronic back pain and back pain in general. So Dr. Hall, the first question for you I have is really like spinal pain and back pain are very prevalent issues, and we know that it's very common. I just want to get kind of your insight and expertise on how common and prevalent it actually is.
It's very common. It has been estimated to be the second most common reason to see your family doctor, starting after just coughs and colds. The World Health has considered it to be the leading cause of disability worldwide, which is terrifying when you consider that puts it ahead of malaria or tuberculosis or HIV, just ordinary back pain. It is the commonest cause of recurrent lost time from work, so that it is a massive problem. It's estimated that about 80% of the adult population in Canada will have back pain, significant back pain at some point in their life. And so one of the points I make is that if you've never had back pain, then you're a strange person, because normal people have sore backs.
Wow, 80%. That is actually mind-blowing. And I can actually confirm that I also have had back pain. So that's
well, there you go. You're one of us. So have I. My first episode was when I was 17. So I've lived with back pain all my life. And I think that, of course, brings up another major point, is that it's manageable. That back pain terrifies people because it is extremely painful. But if you know what to do, if you know how to handle it, it's nothing to be afraid of. And it's something that you can manage very effectively.
Absolutely. And I think that's reassuring to let people know. On that note, are you able to talk about some of the common causes of back pain that you've come across, or
Another one of these statistics that people just don't realize, better than 95% of all back pain is caused by simple mechanical malfunctions in the spine, minor issues, wear and tear in the joints, wear and tear in the discs. If you look at sinister causes, serious causes, they account for less than 3%. And malignancy, which everyone's terrified about, accounts for about 0.5% of all the back pain that you will ever see. So that the major cause of back pain is just ordinary wear and tear. It's being human. And in fact, that is one of the major problems that we've faced. The medical establishment has tried to medicalize back pain. They've tried to turn it into a disease. They've tried to turn it into an illness. They've been very successful in doing that. And so naturally, then people say, well, then, okay, it's a disease. How do you cure it? And there is no cure for back pain, because back pain is a human condition. It's as natural to have a sore back as it is to have gray hair. And just like you can cover up your gray hair if you don't want it to show, you can cover up your back pain if you don't want it to hurt.
Oh my gosh. Okay. Yeah, that's a really interesting perspective, because often when it comes to things with your back and your spine, people freak out. And that's, I guess, the associated stigma it has in terms of like, oh my God, you've reached a point where you have back pain. This is not good. So that's really interesting. I guess in terms of that, what do you, in terms of if you have advice to offer, or just in terms of knowledge, access for back pain that can be managed? How can we go about, or how can people listening to this podcast go about accessing care that can help manage these situations?
Well, the first thing to recognize, and this is something that we've been working on for years, is that mechanical back pain, that 95%, comes in very discrete patterns. There are very clear patterns of back pain. The commonest by far is a back pain that is increased when you bend forward, when you reach down to pick up something, pick up the groceries, pick up the baby, bending forward or sitting for a long time, because when you sit, your back is actually flexed, it's bent forward, is the commonest mechanism for causing back pain. Now, there are other types. There's a very small subgroup which hurts only when they bend backward, which is kind of unusual, but they're out there. There's lots of them. Separating back dominant from leg dominant is probably the very first step. Is your back pain worse in your back or your upper buttock, or is it worse in your thigh or calf or your foot? Back dominant pain is almost entirely mechanical. And intermittent back dominant pain, pain that is in the back but at times will completely disappear, even for a moment or two, is never a malignancy. And that's such an important point, and it's such a simple thing for everybody to understand. I have a sore back, it hurts a lot, I'm terrified, but in the morning when I wake up for a few minutes, I don't have any pain at all. And that momentary total elimination, and here be very clear, I'm not talking about getting better, I'm talking about it disappearing completely, which it does in most cases. And if it disappears totally, and if it's in the back more than in the leg, then that is a mechanical problem. Leg dominant pain, pain that's in the back but radiates into the leg so that the leg actually hurts more than the back does, is almost always caused by nerve root irritation. This is where people talk about the pinched nerve. It's not actually pinched, it's actually chemically inflamed. That doesn't matter, but it hurts. And it's leg dominant pain. If you have persistent leg dominant pain associated with your back, so that when you move your spine, when you bend, when you twist, it makes the leg hurt more than the back, that is a reason to visit your doctor. It's not terrifying. It doesn't mean anything awful is going to happen, but it is involving the nervous system and it's worthy of a medical check. If you have back dominant pain, which may radiate to the leg, this is where people get very confused. You can have both, but I must insist you tell me which of the two is worse. So if it's back dominant, maybe yes pain, maybe leg pain, yes or no, but it's worse in my back and it disappears for a few moments, that is something that I think you should be able to manage yourself. If you're frightened, if you don't unsure, see your doctor. But again, so many people wind up seeing their doctor only to be told there's nothing I can do, it's just back pain. And worse than that is when you get sent to the surgeon. Now you're waiting to see a surgeon. You're terrified that something awful is going to happen to you. The surgeon sees you, and in Canada, the wait can be months long. Yeah. You get there, the surgeon says, I can't help you because there's nothing to operate on for simple wear and tear. The patient gets the idea that that means I'm incurable. What the surgeon said was, it's not a surgical problem, it's a mechanical problem that you should be able to fix. So there's a disconnect in the communication. Everybody gets frightened, the surgeon gets upset and angry, the patient gets terrified, and back pain just keeps being a huge problem for disability for everybody.
Oh my God. It actually puts into perspective that a large portion of it is this miscommunication and this disconnect, and the impact on the quality of life that it has on this patient is just astronomical.
Well, the impact is enormous. And this is why it's such a big problem. I mean, the advice which goes out, sort of glib advice to doctors, just learn to live with it, they say, tell the patient, just carry on, just go back to work. Well, if I could carry on, I wouldn't be in your office asking for help. So first, as a physician, I need to recognize this is very painful. I don't know how bad your back pain has been, but I've had episodes where it's taken me right off my feet, where I've actually been knocked down by my back pain. And if I didn't know as much about it as I do, and if I was so unafraid of it as I am, I would be terrified.
Yeah.
And I can just imagine someone who suddenly finds their back pain spasms and they lose their balance. They're lying there thinking, I'm going to die. This is going to kill me. It isn't. It hurts, but it gets better and you know how to control it. And so the misconception that back pain is just incidental. No, it's a big, big problem, but it is not a malignancy. It is not a surgical problem. It is not a lifelong disability. It is something which can be managed. And so balancing how much it hurts and how frightening it can be with I know it's going to get better, it doesn't scare me, that is a tough balance, and it's a tough message to sell.
Yeah.
It's hard for me to convince patients that things will get better if they just do as they're told. That is really something that takes a lot of effort. And unfortunately, many physicians don't know that. They really don't understand the problem very well. I had a young doctor was terrified of having a disc problem. It was his back, it was his disc, and he was just terrified. How could he possibly reassure his patients when he's frightened for his own condition? So that the doctors need to have a better understanding of how serious it is in terms of disability, as you've said, in destroying lifestyle, and yet how straightforward it is in terms of management.
Yeah. Wow. That was a very important. That was precisely my next question, but you hit it now. Point is on point. I guess to just kind of get to my next point. So we spoke about what we can do as healthcare professionals in terms of addressing this. How about someone at home right now who's having back pain? I know we went through the criteria, but if there's some things that in terms of very short and to the point, you want them to remember, what would you like people at home experiencing back pain?
Well, number one, the first thing I need you to do at home with your back pain is to determine, is it back or leg dominant? And again, as I've said, if it's back dominant, it's probably mechanical, we can deal with it. The second thing I need you to do is tell me, is it worse when you bend forward, or is it worse when you bend backward, or is it hurt in both directions? If you're one of the lucky ones, it'll hurt to bend forward, but it will actually feel better when you bend backward. How many times have you seen people stand up from sitting for a long time when the first thing they do is arch their back because it feels good? Now that particular pattern of pain is easy to manage. It's managed with arching backward, standing up, but lying down and pushing your back up. Use your arms to raise your shoulders, let your back relax, is a very good maneuver for these people. Now this is back dominant pain, worse with flexion. If your pain is the other way, and there is, as I said, a small group whose pain is worse when they bend backward, the trick there is very simple. You just slump forward. You work in the direction opposite to the direction that produces your typical pain. That sounds so simple. Surely you're saying it's got to be more than that.
Yeah.
Mechanical back pain is related to movement and position.
Yeah.
You find the movements that feel good, you find the positions that feel good. For that big group that hurts to bend forward, you get a small cushion, a lumbar roll, a little support in the small of your
I
back.
actually have one
So that
here.
when there you go, exactly. And so when you sit, you arch back over this and you feel better, you sit longer. So mechanical back pain is treated mechanically. It's not treated medically. That's another big issue. And having said this, I've got to just take this point right now. The commonest reason for narcotic prescription addiction is back pain.
Oh, wow.
That narcotic weapons that swept North America, the biggest single cause is back pain.
Wow.
And there is no place, none, for narcotic medication in mechanical back dominant pain, ever. I don't care how much you tell me it hurts, you are not a candidate for an opioid. So that knowing this and recognizing that the treatment for back pain is mechanical, it's positional, it's movement. Yes, I can take an Advil. Yes, I can take some pain if it's not quite enough. But to go further than that in a medical direction is absolutely wrong.
Wow. Wow. Okay. That puts a lot of things into perspective. That's just, you don't think about these things. You don't think about the fact that not how easy it is, but how often we okay, this person probably needs something to help with the pain, but we're not addressing the actual problems. Really interesting.
No, that's right. And unfortunately, and because of the addiction issue, it's making it worse. Yeah. I mean, it really is terrifying to me to see how many people's lives have been destroyed not by the back pain, but by the treatment they received for the back pain.
Yeah, our actions.
I go back, as I said, my first episode was when I was a teenager. And back then, and I will not tell you how many years ago that would have been, back then, the idea was you went on bed rest. The first thing they did when you had a bad back was they put you to bed. The second thing they would do is they'd put you in a body cast. They would put you in a brace or something to stop the back from moving, which of course is the very wrong thing to do. The back wants to move. Bed rest, persistent bed rest, staying in bed for a week destroys the muscles in your back so quickly. It's amazing how badly you deteriorate just being in bed for 7 days. So the answer is keep moving. Now, I'm not saying just go back to work because, ignore your pain. You can't ignore your pain. But what I do say is use your exercises, the stretches, the extensions or the flexions, the posture changes. Keep moving within the limits of the pain. It may take some time. You may be off work for a few days or a week if it's really bad. But just like a bad cold, you can get over it. You can take the time off you need. and then get back to life.
Amazing. And I guess my next point in question is, what is the role of something like physio in helping with back pain? Because I think people they don't understand or like really know what the role is. What is
People
your
don't
thoughts?
understand physio because there's no such thing. I mean, to say I took physio for my back is like saying I took medicine. It doesn't tell you anything. It doesn't tell you what you took. Physio ranges everywhere from education and exercise and training and
Mhm.
coaching, which is what it should be, to uh, ultrasound and hot packs and touchy feely. And, you can go a full range. Some
Mhm.
are very good. And I work happily with a group of therapists working with the Canadian Back Institute, CBI Health Group, it's now called. And CBI Health Group, we train our therapists to look at back pain as something that needs to be educated and worked with the patient. And so I'm very happy with what I see. But even there, it's so easy to fall into the patient wants something magic. They want the machine that goes ping. And so you give them something. I've actually had therapists complain that when they educated the patient and taught them what to do and spent time explaining, the patient then said, well, when do I get my treatment? Well, that is your treatment. Learning what to
Yeah.
do is your treatment. It's not putting on a hot pack and rubbing my back for a while. It feels great, but it
Mhm.
has no lasting effect.
Yeah.
So if you're going to go to therapy, be sure what you're getting is something that has a beneficial effect long term, not just a short term, rub or poke, but something that will help me to cope with my problem. Which, by the way, and that's another statistic which kind of scares people, your chance of a recurrence is about 70%. If you've had it, you're almost certainly going to have it again. Very few people have only one episode of back pain.
Mhm.
And so knowing that means that I need to know what to do now. When I'm pain free, I do nothing. Nobody does their exercises when they don't need to. But the minute it hits me again, I learned what to do last time. I do it again. And amazingly, it works.
Mhm.
The patients that I chuckle about are the ones that come back to me who are so cocky. So say, I had an attack, but I fixed it myself. I didn't need to see you. And they think that's going to make me unhappy. I'm delighted. Now taken the ability to what I showed them, what I taught them, worked the next time. And that's the ultimate goal. So now the control is entirely within your hands. You know what to do. You're not afraid of it. You live your life with back pain like I do. If it gets in the way, I know how to stop it. And I just keep on going.
No, I think this was a very powerful message. Like in this talk, is just we don't often recognize that medicine isn't about pills or getting that intervention or surgery. That knowledge and awareness and just that education in itself is the medicine that some people, quote unquote medicine, that some people need. And I think that's a very key point that like I really really want people to take home, that yeah, I can be teaching you something, but that is ultimately the best thing for you, more than the imaging and more than the injecting you with things that you think might help. And I think that's really 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 important.
Our job is to give you the knowledge to do what you need to do to help yourself. Now, there's still a place for surgery. Surgeons, I'm a spine surgeon, and about 3% of all the back pain out there needs me as a surgeon. Now, that doesn't sound like very much, but when you consider that 80% of the population, so we're talking, 20, 25 million people, I'll take 3% of that. That's enough to keep me busy as a surgeon. So I need to go looking for work. There's lots of it out there,
Yeah.
but they are the minority. They are the
Yeah.
people that have something serious, that 3%. They are people that have nerve impingement that is bad enough that it needs something done.
Mhm.
They are almost never the people with ordinary mechanical back pain. Surgery for mechanical back pain doesn't work very well. The standard operation is a spinal fusion. And when you look at the literature, spinal fusion isn't very successful. It's what we have, it's what we use, and occasionally it's the right call, but in almost every other case, don't do it. That's why going to see a spine surgeon just for ordinary back pain is not a smart move.
Okay. And I guess just to end things off, I came across your organization, the Canadian Spine Society, and this really amazing website called Back Care Canada that you guys have affiliated. And then you're also talking about the CBI Institute. I was wondering if you can just maybe provide a little more information about all these different organizations, what they offer, and what people who are listening can find on these
Right.
websites.
Well, the CBI Health Group is a private physiotherapy rehabilitation system. It's got centers across Canada. There's about 300 locations now. And it is a well-run, I think, physiotherapy program, so that if you need therapy, and again, I'm not saying you should go there. It's when you need that extra help or education, that little extra bonus, that's when they're helpful. If you can do it yourself, please do it yourself. The Canadian Spine Society is an organization of neurosurgeons and orthopedic spine surgeons. We are the largest sort of professional organization for spine in Canada. Our job is to educate ourselves and then try to outreach to governments, to hospitals, to try and promote good spine care, which is a big job. Back Care Canada is a website which we sponsor, which is for public education. It's a great place to start. And as a matter of fact, at the moment, we have a couple of very young, aggressive surgeons who are also very good in computer programming, who are going to rework the site. Back Here Canada, we're hoping, is going to become even better, more interactive, more useful. So our goal is to try and educate the public, strange as it sounds, to keep them out of our office. I would very much like not to have to see a lot of people with ordinary back pain who could have looked after themselves. And I'd like to limit my surgical practice to those people that need surgery. So the CSS, the Canadian Spine Society, is a professional organization aiming to improve our care, our knowledge. We talk to each other. We promote education. The Back Care Canada site is for the public, and CBI Health Group is a private organization, a private physiotherapy rehabilitation company, which I think does very good work.
That's fantastic. And it's funny because often when I talk to people and I see them in the hospital or wherever, it's like lovely talking to you, but I never want to see you again. And I think that's kind of the take home message here. Like if we
Don't take that the wrong way.
Yeah, exactly. If we can empower you guys to stay home and take control of your health, and that's exactly what we want to do.
Absolutely.
Well, thank you so much for this powerful talk, Dr. Hollins. We really appreciate it. And I really think people listening are going to take home a lot from this. Thank you so much.
My pleasure. I hope it helped.